SID. Since I'm doing this tabletop, I cannot rely on the console here, right? I do need to make sure to pull up my tape measure and measure down to my IR, make sure we're actually at 40. So don't just rely on this. Okay. Oh, sorry, let me get some gloves here. Oh, still here.
I know we haven't gotten to the whole web part,
Yes.
but will the patient's feet always fit on the IR? Or will we change the IR depending on the size of the patient?
So most patients' feet will fit on the IR. I've never seen a patient with a foot that did not fit on a 10 by 12.
Okay.
But in the situation that you did have a foot that was too big, you could always switch to a 14 by 17.
I'm asking because I'm here saying 2 by 10.
Mm-hmm.
Yeah, so.
Okay, yes.
Yeah.
So you will use the smallest cassette that fits the patient's foot.
Okay.
So you could use an 8 by 10. If it's too small, 10 by 12, that's too small, then 14 by 17. Okay, let's see. All right, if you would lift up your foot, please. Okay, just gonna put it right down here on top of the IR. Okay, so we are gonna start with toes. Okay.
Should we turn off
Is
the
it,
light?
yes, go ahead and turn off the light. It might make it easier to see. I'm just gonna, let's see, slide you here to the middle. Yep, there you go. All right, so Daniel, which toe is bothering you today?
I'm gonna go with my big toe.
Your big toe, okay. So gonna be looking at this big toe. So with the toes, if you take a look at the foot, actually, I'll move this out of the way just for a minute. Just put your foot down, nice and flat. Gonna turn your knee. Good. All right, so if you take a look at the way the foot rests on the table, right? The foot here is slanted, correct? Which means that these joint spaces in the toes are also going to be slanted. So if we shoot with a perpendicular beam straight up and down, these joint spaces are going to be closed. So what do you think we need to do? Oblique the foot like this. So moving the foot like this will not open up those joint spaces, right?
Angle the tube.
Good. Instead, we're going to need to angle the tube. Right, so for toes, we have a range, right? What is the range for toes?
10 to 15.
10 to 15. 10 to 15. Okay. All right. All right, very good. Daniel, you lift up. Yes.
That's my mama for them.
Okay. Alright. Let's see, since we are on tabletop, I don't need to lock this, right? If you are using it with the table bucky, you will need to detent. On tabletop, I don't need to worry about that. I'm just gonna go ahead, lift up slightly. I'm just gonna slide this over. There you go. Okay. So we have a 10 to 15 degree angle based off how these toes are resting. Our centering point is going to be slightly different compared to when we were doing fingers, right? When we did fingers, what was our centering point?
MTP?
Yeah, MC. Yeah, MC.
So for the thumb, MCP.
MCP.
For the other fingers, it was PIP, right? Okay, for the toes, it doesn't matter which toe you're doing. Big toes, small toes, they're all the same. We're gonna be at the MTP for all 5 of them. Okay, so I'm just going to take this and center right there on this first MTP. Okay, lift up slightly. Let me just fix my IR. Good, back down. Good, slide your foot back just a little, bend your leg a little more.
Oh, bend it.
Yep, bend your leg. There you go. All right. Slide back, slide back. Good. All right, so we're gonna be right there on that first MTP. And our IR should be pretty much centered. Okay. Very good. We would have our patient shielded as well, correct? Shield just goes right over the lap. You can do that at the beginning of the exam, so that we don't forget about it.
I will